What they're working on right now is legislation called a reconciliation bill, which would give over $1 trillion in tax breaks to the top 1%, and they would pay for that by making massive cuts to Medicaid. And we are here to say, sorry, you're not going to get away with that.
As Congress gets set to return to Washington next week and negotiate the details of President Trump's big, beautiful budget bill, Democrats are sounding the alarm, accusing the GOP of wanting to gut federal entitlements, including Medicaid, which now spends more than $850 billion a year. But my next guest says Republicans have a chance to repair a program that's broken, and it's being gamed by states and isn't helping the neediest as it should. Brian Blase is the president of Paragon Health Institute, and he served as special assistant to President Trump at the National Economic Council in his first term. Brian, welcome. Good to see you. So let's start with this claim that the Republicans would be gutting Medicaid, cutting it. Is that what they're talking about doing?
No, actually, Paul, the projected changes would just slow the growth rate of Medicaid. It's projected to grow about 5% annually over the next decade. This would just reduce that growth rate to about 3%. Importantly, the program exploded in size during the Biden administration, as ineligible people were kept on the program longer, and states employed sort of these very sophisticated Medicaid money laundering schemes to maximize federal revenue.
So it's really going to keep exploding if we don't somehow get it under control. How do the states game the program? Explain that, because I think people don't fully understand how that happens.
So the key feature of Medicaid is that the federal government provides an open-ended reimbursement of state spending. So the more states spend, the more the federal government reimburses. And states actually don't need to develop real expenditures in order for the federal government to reimburse them. So for decades, states have employed financing gimmicks that largely result in the provider sending money to the state, that the state then just sends right back to the provider. And then in the process, they get federal Medicaid money. So it's a way that states and providers can collude and maximize the federal Medicaid revenue that's coming in. And they've done this for decades, and it's grown worse under the Biden administration. And the tremendous cost increase in Medicaid has been entirely borne by the federal government over the past few decades.
Because it's a joint program like this, it gives the incentive for the states to do this. One of the things that's happened, as Medicaid, when it passed, and it's always supposed to have been a program for the poor, for people who really, really can't afford health care. But one of the changes under Obamacare made this able-bodied adults eligible. How is that expanded the program a great deal? And is that really what we ought to be thinking when we think about Medicaid?
Yeah, so most of the growth has come from Obamacare's expansion, and Obamacare actually discriminates against the most vulnerable. So the federal government reimburses 90% of states' expenses on able-bodied working-age adults, and a much lower percentage on spending for traditional Medicaid populations like people with disabilities, children, and seniors on the program. So one thing that we think is really important is that the federal government should reduce the discrimination against the most vulnerable. We know that access to doctors has declined for traditional Medicaid recipients with the surge of Obamacare spending. And it is, I think, should be a priority for Congress to equalize the federal payment rate so that it's no longer paying much more for the able-bodied on the program.
And so the states have an incentive, because they get reimbursed at 90%, to put more of those able-bodied people on the program. Another source of debate here is whether there should be a work requirement in Medicaid. What do you think of that idea, which some of the states would like to impose?
Yeah, so the work requirement that we're looking at would be for this able-bodied Obamacare population. And I think it's reasonable for the federal government to say, If you're going to benefit from a welfare program and you're able-bodied and working age, you should be able to meet a certain set of work requirements or sort of job training, skill development. And I think that is something that is definitely part of the conversation right now.
Do you think that's fair? I mean, some Democrats would say, what do you mean? If you need health care, you need health care. Why should we work for it?
Yeah, I mean, I think it is a very positive effect on people's health to be productive, to engage in work, and so I'm fully supportive of work requirements throughout welfare programs. And I think it's we can't have a quarter of the nation's population on this welfare program. It is just unsustainable at its current trajectory. And one of the goals should be to move people that are able-bodied and working age off of welfare for their health care and onto private coverage, ideally through an employer-based plan.
Yeah, the government can't sustain it, and there's really a moral argument here as well that people should have to work for benefits. That's a pretty powerful argument if Republicans make it.
Yeah, I think there's two real powerful arguments. One is end the discrimination against the most vulnerable, and the second is take on the corporate welfare aspect of the Medicaid program. So a lot of these financing schemes have really benefited big hospital systems and big insurance companies. And so we need genuine welfare reform in this program, but a lot of the reform for Medicaid has to be addressing the corporate welfare.
All right, Brian Blase, thanks so much for sharing your expertise. Appreciate it. When we come back, the Trump administration says it will resume collections on defaulted federal student loans for the first time in 5 years, accusing Joe Biden of misleading borrowers about his authority to wipe away that debt.